Hi, my name is Nidhi Sharma. I'm a women's health physical therapist here at FuncPhysio Physical Therapy. Today I'm going to talk about ultrasound and rehabilitation and why it's important and very beneficial for patients as well as practitioners. So in pelvic floor physical therapy, one of the biggest challenges we face as practitioners and even as patients for you is that you cannot see pelvic floor muscles. They are present deep inside the pelvis. They are not visible from outside, and it's hard for patients to feel what they're doing. It's hard for practitioners to show patients what they're doing. And that's why ultrasound solves this problem. With ultrasound, we have two different heads. We have a shallow head that is used for looking at muscles. So when we use this head, we can see skin, muscles right under the skin, thin tissue which is much more superficial, and we can see more details when it contracts, when it relaxes. With the deeper head, we can actually start to see organs, and this is a great head to see pelvic floor and bladder, uterus, rectum, all of those things that are much deeper. We can still see those things, see how they move, and see how they function. Now, there are many imaging techniques that can be used for pelvic floor and throughout the body. There is CAT scan, there is MRI, there are other things that can be used. So why ultrasound? Why is ultrasound better? Well, one, the more important thing is you can see ultrasound and you can do ultrasound with movement. So when we get an MRI, you have to sit still. Right? So you can see what your pelvic floor looks like, you can see what your bladder looks like, but you can't quite see what happens when the pelvic floor contracts. Okay, what happens to bladder when pelvic floor contracts? So you can't see that. In ultrasound, we can actually see it. We can do ultrasound with movement, and that's why it becomes so important and so beneficial in rehabilitation, because movement is so important. What happens in stationary positions, you never leak when you're lying down. You don't feel your prolapse when you're in your bed. You feel your prolapse when you're walking around. You leak when you cough, when you sneeze. So those are the times that problems happen, and those are the times we need to see what is the pelvic floor doing and what is the bladder doing. The second benefit is it has no side effects. Unlike other imaging techniques where there's radiation and you don't want to be exposed to it again and again, ultrasound is totally harmless to tissues, and that's why it's done again and again in pregnant women, because we know it does not hurt the fetus, it does not hurt the baby. So it's the kind of technology ultrasound uses does not hurt your body. So we can keep using it twice a week, every week, over a period of time, and really use it as a visual biofeedback during the entire rehabilitation process. And there are very few techniques you can use throughout the time without any side effects, through movement, and really without any invasive procedures. And that's why ultrasound is really, really helpful if we are considering pelvic floor rehabilitation. I'm going to record more videos. We'll talk about how ultrasound is used for organ prolapse, for how ultrasound is used for leaking, and how ultrasound can be used for diastasis rehab as well. So stay tuned. Thank you.